I'd like to introduce the next part of our meeting, where we'll feature organizations across our Accelerating the National Climate and Health movement. Each of our panelists touch on aspects of climate and health, ranging from children's health and education, future clinicians on climate and health, sustainable practices, safeguarding workers, reducing healthcare's environmental impact. We'd like to thank Dr. Jeff Thompson as a member of our Climate Collaborative who's agreed to facilitate this panel. Dr. Thompson is is Executive Advisor and Chief Executive Officer Emeritus at Gundersen Health System. Dr. Gundersen is a pediatrician, author, and speaker on values-based leadership. His experience in leadership is far-ranging. He's led complex organizations and teams and divisions before holding multiple senior executive roles, including 14 years as CEO, responsible for staff of 7,000, hundreds of thousands of patients within the Gundersen Health System. His experience as an intensive care pediatrician and senior executive has demonstrated that leading from one's values has the power to affect meaningful and lasting change. Jeff, if you'd like to join us and introduce our panel, that would be terrific. There we go.
Thanks, George. Thank you. Thanks, George. I appreciate that. Longer than needed. But we will make quick work of other remarks and move on to the panel. I think we had a great opening so far, and the purpose of the panel is to tie together what you've heard in the other talks to what's really going on out in the world. There are the challenge from Victor to make sure our tent is ever expanding. Senator Frist saying we need to do things. People are confused. What can be done? Don talking about will, ideas, execution. And then Dr. Callaway very thoughtfully saying this is climate, of course, but pollution is killing 350,000 just from air pollution alone in this country alone every year. So there's urgency to add to the will, and the ideas. Well, the ideas are going to come from this group here, and I will have no further remarks right now and introduce the group in title only. In the resources area, we will have much more of their bios explained. The amount of accomplishments in this group alone is enormous. Our speakers will be Gary Cohen, the co-founder and president of Healthcare Without Harm, N.C. Witherspoon, executive director of Children's Environmental Health Network, Gaurav Vashi, from the executive director and CEO of the New York State Insurance Fund, Robert Turkile, vice president of sustainability at McKesson, and Dr. Cecilia Sorensen, the director, Global Consortium on Climate and Health Education at Columbia University. So, broad group, and without any further delay, I will give them as much of their 5 to 6 minutes to explain decades of work as possible. Gary, take it away.
Thanks so much, Jeff, and thanks to the National Academy of Medicine for holding this space and creating a safe place to really bring so many different parts of the sector together. It's been really, really catalytic and huge. So I just wanted to talk, in my 5 minutes of fame here, key things that I think everybody knows, but around the role that I think we need to play. It's been talked about as not just decarbonizing healthcare, but detoxing. We are huge users of toxic chemicals and fossil fuels, and these are things that are killing more people than anything else on the planet now, regardless of their impact on climate change, just from the pollution. We also understand, and what David was showing, is that we in healthcare have to anchor the communities in crisis. And we see that, whether that's in New Orleans or New York or in Appalachia or in Pakistan, we need to be the last building standing. We need to understand also the vulnerabilities of the people that we serve, many of whom are already suffering trauma and racism and economic disparities and health disparities. And what's our role in helping to hold those people? We're not the real estate industry that runs away from climate change. We are healthcare. We're taking care of people. And then third is a really critical role that I think we're still just learning to do is how do we exercise our leadership, our voices? How do we change the narrative? How do we overcome some of this incredible polarization to have people unite around the fact that we all care about our kids? We all care about our communities. How can we change the policy landscape by talking about the health of everybody in our communities and the impacts that this pollution is having on people in our communities and around the world? We're in the very early innings of that piece of work. I'm just going to go back a couple of years ago. The private sector at a global level by the United Nations said, let's have a race to zero. And they invited businesses and cities and investors and regions and universities to join in this essential voluntary effort that Don was talking about. Healthcare wasn't involved. And then the UN asked us to say, well, could you mobilize your network to do that? And so over the last few years, there's been 70 organizations that represent over 14,000 hospitals in 30 countries that have committed to this race to zero. It's very similar to the HHS pledge that we have in the United States, in which 1,000 hospitals have signed on, plus 200 plus hospitals from the VA and the military hospitals. So there's enormous momentum in the private sector. In the public sector, in governments, Healthcare Without Harm organized with the World Health Organization 12 years ago, the first Climate and Health Summit. There were very few people there, trust me. And over the course of 12 years, we've built up with government and with all of you and with many, many people around the world, the momentum to say we need to have a strategy around a health program. And so in Glasgow 2 years ago, with the WHO and the British government, we organized a health program around the same stuff we're talking about here. You know, how do we move around our addiction to fossil fuels? How do we anchor resilience in our communities? And over the last couple of years, that's turned into this Alliance for Transformative Action on Climate and Health. There's 84 countries involved now. So the extraordinary momentum in the public sector. A couple of weeks ago, we were on the stage with the Clinton Global Initiative, and we said, you know, there's not enough. We need a bigger cohort. You have 70 organizations in 30 countries. We need to double that. We need to double that. We need more people, more places, more systems all around the world that are making this the new normal, that are embedding climate and health and equity into their DNA. And so we made this commitment to double the number of hospitals and systems that are part of this race to zero. And I'm asking us all here that we want to double the number of hospitals that have joined the HHS commitment. If we have 1,000, let's get 2,000, because then we'll have more than 30% of the entire sector, and it starts to create the conditions for normalizing this, for policy, because the policymakers would say, well, large part of the movement's already, you know, large part of the sector is already moving in this direction. It becomes safer to actually institute mandatory policies because the sector is moving. So that's an opportunity, and if we could all work together on that, it would be amazing. In the last year, There was a lot of work by OCHI to sort of talk about this incredible opportunity of the Inflation Reduction Act. And so, and there were a lot of sessions and educational opportunities. We feel like we need to show how this can be done. So we're partnering with the America's Essential Hospital and that network of 300 hospitals who are mostly taking care of Medicaid and Medicare patients in our inner cities. To actually access these funds. And so we're providing grant funding to support hospitals to actually do like real estate investment grade evaluations of what they could invest in, and then bring that to the folks who got the money from the Inflation Reduction Act and help them make their buildings resilient so that they can actually operate. And they're not people being evacuated from the roof of those hospitals. And so we're hopeful that we can get 10 or 15 hospitals that are implementing IRA funds and implementing resilience, and then show how the rest of the sector can do it. Last couple things. We have thought that the health insurers have been kind of sitting on the sidelines for a long time in this issue. And so a couple weeks ago, we brought them together in New York during Climate Week to say, what's our role in this? And there's enormous role because there's an opportunity to change reimbursements. There's opportunity to change contract language. And Gaurav is going to talk about one of these really exciting opportunities that New York State Insurance Fund is, but there's a huge opportunity for leveraging the insurance industry to actually start to pay for the things that we want to pay for, and to incentivize the things and to disincentivize the things that we don't want. And so a lot of opportunity there. Last two things I'll say is just we've come to understand that the 99% of all the toxic chemicals that are made from fossil fuels. And as the market shifts from reliance on fossil fuels for energy, for transportation, that the fossil industry sees that the future market is in petrochemicals, is in plastics. And the estimates are that 2050, half of all the oil demand will come for producing petrochemicals, and plastics in particular. And so this is a photo of one surgery and the plastics that are produced in one surgery. So there's a huge requirement on all of us to figure out how do we move away from these mountains of single-use plastics that are not only contributing to pollution of the ocean, pollution of our bodies. Kids are being born with microplastics. Like, what a violation of fundamental human rights. Don't you think our children have the right to be born toxic-free and to have clean air and clean water and not to be poisoned by PFAS and other chemicals? It's such a fundamental issue around our core ethic to first do no harm. So there's a momentum now that's happening, and there's a global treaty happening around plastics. And if you were at the Ottawa meeting, the last treaty negotiations, the second you got off your plane to go to the treaty negotiations, there were billboards all over Ottawa saying, plastic saves lives. So that the healthcare sector is being the raison d'etre for why the fossil fuel industry needs to continue to produce more and more plastic. We have to have an alternative narrative about that and how we're moving away from most toxic plastic, the most persistent plastic. So this is a reflection of the momentum that's happening now in the healthcare sector to show up and to say, actually, not on our watch. We're not doing this. So I'll stop there, and thank you very much, and I'm so excited to be part of this amazing movement.
Thanks, Gary. That was terrific. No doubt the scope and impact of healthcare without harm over the many decades has been enormous, U.S. and around the world. And as always, you're out ahead of the crowd. We need to be thinking about plastics. I just heard at the Clean Med meeting this year a presentation where the current calculation is between 2045 and 2050, the time that you were pointing out. The weight of plastics in the ocean will rapidly go past all the fish in the ocean. Something worth remembering the next time you're eating your broccoli. Okay, next. On to NC.
Thank you. This has been a tremendously important and vital discussion so far. I'm looking forward to today. Again, I'm the executive director of the Children's Environmental Health Network, where our basic mission is to protect all children and the developing fetus. So reproductive health is extremely important to us from known environmental hazards and now increasingly changing climate and all of those implications. I'm also coming as a mom of 4. I'm very passionate about this, and I don't believe that obviously children should be born pre-polluted, and there's a lot that we could be doing that we are not doing. I say often, and I'll continue to say that climate change is the largest children's environmental health issue of our time, because it exacerbates all the other major routes of exposure. So water pollution, as was mentioned, air pollution, and let's not forget our built environments and, of course, food systems, where children spend a lot of time in their childcare, their schools, their homes. All of those are being disrupted now on a daily basis due to climate change. Oh, I'm sorry, I forgot. I have slides for y'all.
Yeah.
So unfortunately, I refer to this often, and this is really the mark for us in this field. As long as all of these chronic illnesses for children are going all the wrong way and increasing in many cases, like childhood cancer has been increasing 34% since 1975, since we've been keeping track. That is not genetics. There's something else going on there, and we do know from some reports that we've done in some of our coalition work, air pollution, vehicle emission, paints and solvents, that's occupational exposures, for example, is a big driver of many childhood cancers. And what about asthma? I mean, when I started in this work over 20-some years ago, childhood asthma was definitely still increasing. It's kind of plateaued, then it's gone up and down a little bit. We know that there are many cofactors to asthma, but obviously air pollution is a big part of that. And of course, 1 in 34 8-year-old boys in this country have autism disorder, they're somewhere on the spectrum. So these are all due to NIH-related peer-reviewed research being shown, at least 25 to 30% of these chronic illnesses have an environmental component, which climate change is just exacerbating. And of course, the disproportionate burden that's been mentioned, I'll just reemphasize that. That's a big part of our work. Children are vulnerable, but especially Black, Brown, Indigenous, lower wealth. We can go on and on about all the social determinants of health. I had the honor of working with Jackie Patterson, the lead of the Chisholm Legacy Project, on a report called Racism That Appends the Cradle during the height of the COVID pandemic, where we just called out the syndemic that Black and Brown and Indigenous children are facing, which is the threat of economic disinvestment over time, generational impact. I'd say also the COVID-19 pandemic, unfortunately, was a display, as climate shows us as well, and of course, climate change. So these are the communities that are hit the hardest and the quickest. So how are we showing up? We are part of the Climate Equity Collaborative, that we are one of the founders of this, which is working at the intersection. It's a public-private partnership of trying to make sure that children are the front of this issue. I really do believe that we have a true opportunity to continue to make sure that we lean in on that general knowledge and feeling that all people generally want the next generation to not have to take the burdens that we are definitely leaving for them. My own children have these climate anxieties for sure. So we're working to drive investments from the sustainable public sector into this realm, lifting up existing programs that have already shown proof of evidence that they're working. They're going in the right direction. They're reducing negative health outcomes. They're increasing health and well-being, and they're reducing our impact on climate and environment. And some of those examples are a global children's environmental health network, which we're leading. So this is not necessarily going to be a whole bunch of meetings. We might come together once in a while when opportunities arise. We were just in Nairobi, Kenya in August, for example, due to some partners. But this is mostly a communication platform. There are advocates and researchers and students and those working in disciplines of all kinds that have a serious need, that no gap, there's a gap there that has never really been fulfilled on the global level over time, to come together, to synergize, to collaborate, and to share best practices and challenges. We have different economic systems and many other challenges, but we have too many similarities, like the need to educate, build awareness, and mobilize. We also are very big in the early learning space, so I really want to lift up the true opportunities we have in learning environments, childcare, and K-12 schools, as far as the footprints that they have, but also the demonstration opportunities that they have, I feel, like hospitals and hospital centers. The Hetchinger report in 2021 reported that climate change and early childhood are intertwined. Both climate and early child care systems are in crisis, and we completely agree with that. Just under 15 years ago, we started the Eco Healthy Child Care Program, which is the only program in the country working to train and educate child care professionals, the providers, the owners, facility managers on low to no cost steps they can take to reduce environmental harms in these facilities, which children spend a lot of time in. Most of these workers are women, women of childbearing age, and women of color. So the dynamics of opportunity in the workforce and generational impacts are huge. We, of course, are using this platform to also engage climate strategies as well, like energy audits and no idling policies and testing air and then monitoring the air for all the different chemicals that are brought in and giving guidance and advice when they can change out their flooring and they can change out their materials, their furniture, to do that in a sustainable way. Planting in non-invasive trees, talking about shade structures because of the rising heat index. We want them to take their children outside, but not to their detriment. So how do we work on that while also working on climate mitigation and strategies? Another program is called the Break the Cycle of Climate Change. This is all under the umbrella of the Climate Equity Collaborative. This also has a long longevity where it's modeled after the Break the Cycle of Health Disparities program that runs out of the Southeast Pediatric Environmental Health Specialty Unit, PACU, and the lead, Dr. Leslie Rubin, is with Morehouse College as well as Emory. It's a fantastic program where it's a mentorship opportunity. So what we've also learned is we have to have on-ramps for our students and our generations coming behind us. We're not going to solve this overnight, but certainly we have to give them the tools and resources to understand the issues and how they can play and how we can also have co-benefits of working with them. So they work on projects, community organizations lift up climate justice related problems that they have. The students work on these projects. They have a mentor and all that. I've served as a mentor in the past. They have a culminating opportunity conference where they display what they've discovered, and then they have a peer-reviewed publication together. So you have a way of supporting that young person in their professional development while also giving them a new lens of how they can incorporate the range of disciplines that they're working in to help work on climate solutions. And then finally, there was one for that. And then the America the Beautiful for All Coalition. So this we're trying to take, I'm the co-chair along with Mark Magana of Green Latinos. We're a very unique, different view, if you will, when you think about a traditional conservation movement, which this really is. We've been working with the Biden administration to advance 30% of the protections of our land, water, and ocean by 2030, a very ambitious but necessary goal, and to make sure we implement a Justice 40 lens so that at least 40% of those protected areas are shown to benefit with serious monitored metrics, the most marginalized communities that have had the least access and benefits over time. So we've never seen ever in our history a conservation movement that also is very intentional about justice and health being at the forefront. So indigenous leaders, community leaders, justice leaders are at the forefront of this. And as far as I'm concerned, as far as we're concerned, we're not going to meet our conservation goals if we're not also simultaneously working on our public health and environmental justice goals. And so my quick call to action is that we need to take short and long-term steps and really make sure that we infuse the needs of children and vulnerable populations into all related activity. The time is far too long now that we always do a retrospective interplay as far as why that policy or why that public health standard is not protecting the most vulnerable. Well, those voices probably weren't at the table from the beginning. If they're not in the plans, they're not going to be part of implementation. There are climate action plans at state levels and local levels. Many of them don't even have the words children or reproductive or women of a pregnant age in them. If they're not in the plan, they're not going to be part of appropriations. Those are true opportunities that are low-hanging fruit. Again, childcare and school learning environments, these are true opportunities to incubate solutions that are working in other parts of our sectors. These providers, these educators are very ripe and interested and very overwhelmed and burdened and need money, they need assistance, they need training, but I guarantee that many groups like us and coalitions we work with would be right there with them to provide the technical assistance that they need, but we need to be doing this in collaboration. Let's also not forget school nurses. They're the only public health trained professional generally in a school building. Not all our schools have a school nurse, only 75% of them. But how are we leveraging that unique expertise as a liaison to serve as a champion in these learning environments? Let's get youth involved. Let's make youth are in rooms like this and that we're learning from them. And also we encourage you to join our movement. Thursday is Children's Environmental Health Day. It's a day of action for and with all children, where climate and climate solutions are a big part of the almost 200 partners now that engage on that day. So thank you so much.
Outstanding. And further example, I mean, there is work in this for everyone, depending on your priority. If it's equity, if it's children, if it's the future, there is so much, and you don't have to do it by yourself. You don't have to start at zero. There are great partners that you can find to work with. Now, for a new work that's important work, expanding the sector, Gaurav.
Thank you. It's a pleasure to be here. Thank you to the Academy for the invitation to speak. And it's a real privilege to actually be a part of this panel, such a distinguished group of people. I was speaking with Gary outside and in conversation, realized that Gary's advocacy goes back to the Union Carbide disaster in India. I remember that disaster as a child in India. I was a young kid, and it was a big news story, lasted for a long period of time, and the results were absolutely horrific. And I also remember it because that was the year that my family immigrated to the United States, and we arrived. So in my mind, I remember the horrors, and then fast forward decades, it still lingers in my subconscious. So remarkable, and I'm humbled to be here with such a distinguished group of panelists. Look, I'm really fortunate to run an organization that I'm inspired by. I run what's called the New York State Insurance Fund. It's a 110-year-old not-for-profit insurance company that provides workers' comp, disability, and paid family leave coverage. I'm inspired by it for various reasons. The first reason is that it has a public purpose. So it's different from private sector insurance companies. Private sector insurance companies who may have stock prices to monitor, shareholders to manage the expectations of. Our public purpose is enshrined in statute. It's broadly aligned with social well-being. And it gives us the opportunity to do a lot of the things that private sector insurance companies wouldn't ordinarily be able to do. I'm also inspired by the organization. This is a little known fact about NYSIF. About 100 years ago, Francis Perkins helped lead the organization. As many of you know, Francis Perkins went on to become FDR's labor secretary, became the first woman to serve on a presidential cabinet, and the longest running cabinet member in history. So I'm humbled and again draw a lot of inspiration from that rich history. But most of all, I'm inspired by the opportunity that NYSIF presents to become part of big things in novel ways. And the work that we've done at NYSIF on climate change is a perfect example of that, and I'll detail some of that for you now. So as I said, we are an insurance company. We have a balance sheet. On the asset side of the balance sheet, we've done quite a bit of work to align our investment portfolio with net zero aims. On the liability side, we looked at our claims data, and we said, well, what happens to people in extreme heat? What is our claims experience? So we looked at 100,000 claims to see what happens to frequency and severity of those claims, and we found a very strong correlation that reinforced and cemented a lot of the notions that we had about climate change. But what I'm truly proud of is an initiative. It's a pilot program that we launched in May of this year that is designed to help hospitals reduce their greenhouse gas emissions and become much more resilient. The structure of the program is actually very simple. If a hospital pledges to reduce their greenhouse gas emissions and become more resilient, NYSIF will provide them with a 5% discount up to $1 million on their workers' comp premium. And workers' comp premiums can be pretty significant, especially for large hospital systems. With those funds being liberated and freed up in a hospital's budget, the expectation is that they would come up with a very detailed and credible climate action plan that would help them reduce their greenhouse gases and become much more resilient to the effects of climate change. For every year that a hospital meets the milestones of its climate action plan, NYSIF would stick with that hospital and continue to provide that 5% discount up to $1 million. We would also provide consulting services to those hospitals to help with routine extreme heat-related issues, but also to help them strategize and come up with programs to help reduce their greenhouse gas emissions and become much more resilient. Why did we start with hospitals? We sort of said, we drew a Venn diagram. We said, well, what is the industry that has a significant emission of greenhouse gases? The healthcare sector was among the largest emitters of greenhouse gases, and hospitals in particular. But hospitals know that, and in large measure want to do something about it. So we had an industry of very willing participants. But we also knew that following COVID, budgets were strapped thin, and even the most motivated hospital might have a difficult time prioritizing the reduction of greenhouse gases. So we said, let's focus our pilot program in the first instance on hospitals, generate some experience from that, and then over time, we'll be able to expand into all of healthcare, and then eventually the entire, all of the sectors that we provide coverage for, true real businesses in the real economy, from manufacturing, contracting, agriculture, and so on. So our experience has been pretty good so far. We launched our initiative in May, so it's been just a couple of months. We've been able to sign on 6 significant hospital systems in New York, 26 facilities. Our numbers are growing. And as we go on with our pilot program, we'll be able to generate data. And the hope is that as the years go by, we'll be able to analyze that data and make a business case for other insurance companies to do the same thing, because it is pretty lonely. There are not very many insurance companies using their pricing power to get this, to incentivize this sort of change in the real economy. And then at the same time, use our data to provide concrete information to hospitals to show them that there are tangible benefits and savings beyond just this direct premium credit. There are savings associated with the reduction in greenhouse gases. So we'll put that information together and hopefully be able to recruit a lot of other hospitals and healthcare professionals to really start focusing on decarbonizing. So be happy to come back in the coming years and report on that data. Thank you.
Well, very creative and very thoughtful. We use the assets we have to make a difference. Again, expanding, you need the will and the ideas. You find partners, boy, making a difference. So thank you for that. Robert?
Wonderful. May I have the clicker, please?
Crisply.
Thank you so much. All right, let's make sure we can get this right. Yep. All right, excellent. Hey, everybody. So Robert Turkile with McKesson, Vice President and Chief Sustainability Officer, here to talk about what McKesson does in the sustainability space. And the way we outline this is really about advancing healthcare outcomes for all and linking it to our core business. This is something I think that you've heard not just from this panel, but from all the speakers, that this is part of what we do and how we do it. We talk about it in our impact report. You can go and read the details. I'd encourage you all to get on and download it. It's a wonderful read. But we talk about in 3 main areas about accelerating belonging, empowering our communities, and improving our planet. I'm not going to get into the work about accelerating belonging, except that my colleague, Jesse Cortez, who leads that work, is very focused on not just building our ERG groups out, but also enabling folks to be involved as part of their work and the things that they do in McKesson, and seeing how they're tied directly into our sustainability efforts. As we look at how we can empower our communities, one of the projects I want to highlight is Project Oasis. And Project Oasis we put in place to address the challenges of pharmacy deserts that we find in 1 of 4 communities in the United States. This is a major challenge. Most of those pharmacy deserts, of course, as we know, are found in underserved communities. Empowering these communities and building this initial pharmacy to address the pharmacy deserts, this one is in Ohio, it actually has a direct benefit on the environment as well. So there's a direct connection to empowering the communities. They don't have to travel as far, so you're reducing carbon emissions. They're not generating as much waste. All of these ties go into also empowering the communities. And as we step back and we look at how do we improve our planet, we at McKesson recognize that our inherent operations are actually causing those degradations. We recognize that climate change is one of the major contributors to the healthcare challenges that we find. And we've been building programs like the McKesson Green Building Standards, where we're actively working to reduce the carbon footprint of the facilities where we operate our buildings. Yes, we use LEED and WELL and BREEAM and other systems, but we recognize that, as everybody knows, the healthcare sector is very specific and unique, and there are certain aspects in how we operate our buildings that we can enhance through our own systems. So taking the best processes that we can find within those existing systems and enhancing them and focusing on them for the healthcare sector drives our reduction in emissions and waste and impact through our McKesson Green Building Standard. So our real estate footprint is a major aspect that we are looking to address. And of course, within our transportation, as McKesson is one of the major distributors in the healthcare sector, looking at how we can not just reduce from an emission standpoint, as you can see here with our electric vehicles, but how do we do it also with returnable products and returnable packaging? How do we train our drivers to be more responsible? Interesting, as we were rolling out the pilots for our EVs, our drivers started asking for them. They wanted more. They wanted more solutions. They started bringing the ideas to the table. And this is one of the ways that we really accelerate belonging is by doing that, taking that matrixed approach and looking for our communities within McKesson to build on our initiatives. And we've had some wonderful successes and a great adoption. In fact, this has led to us expanding beyond EVs and looking at full alternative fuel vehicles where we're now testing propane conversions, which is a seamless conversion for us. It's very easy to just convert a regular Sprinter van into a propane vehicle, which then directly reduces greenhouse gases, and there's absolutely no change or reduction in services. But as we think about this, I think this is really where, for us in McKesson, it's around, well, what's next? How do we look forward? What is that call to action? How are we trying to think about what do we see coming down the road? And part of the reason I use this picture, this is not one of my daughters, but I have two daughters. And I've always envisioned them kind of looking forward as they've grown up through life. They're 21 and 17 now, amazing to say. But I think as we think about McKesson and as we think about the healthcare sector, one of the critical elements that we have to do is bring our supply chain along with us. We talk about great things that we're doing with McKesson, but are we fully engaging our supply chain? We have an opportunity there. I think we collectively have an opportunity to break down the barriers that we see as competitive advantage and making supply chain action open and free for all. We have an opportunity to bring those supply chains to small and medium entities along with us. And that's one of the ways that we're trying to help facilitate and grow and activate the sustainability journey map that we've been doing through our actions here at NAM. We also are trying to change the conversation, right? This isn't about measuring the tons of carbon that are reduced. Yes, we report on that. Yes, we track it. And yes, it's important. But it's about realizing in those tons of carbon that are reduced, we're also reducing the instances of asthma and other serious lung diseases. We're protecting the natural environment that we rely on for our supply chains to operate the healthcare systems, from our food systems to the raw materials that we need to just be able to operate, as well as the raw materials that we need for the medicines that are being made. It's kind of ironic, right, that the healthcare sector relies so heavily on our natural environment, but really we have very little action in that space of how do we protect it? How do we ensure that the next raw material for the biopharma that is coming out of nature is actually identified, found, and not destroyed before we can actually use it and find it? We're also looking to actively dissemble and to remove all of the challenges that we find with the disparities in the action around climate change? How do we continue to build strong, resilient communities and do it in a fair and effective way? And really about removing these adverse conditions that we find that actually come from the environment that create cancer. 95% of all cancers come from environmental causes. This is just part of what we all know. And can you imagine if we as a healthcare sector are directly impacting the reduction and elimination of environmentally caused cancers? That's a major way for us to be activated and to move forward within the healthcare sector. And of course, that ties back to what we're doing at McKesson, which is really around advancing healthcare outcomes for all and finding ways to bring our supply chains along with us. And we're just very fortunate and thankful to be part of this great community and the work that we're doing here with NAMS. Thank you.
Thanks, Robert. I think it is so important for organizations like McKesson to stand up and say, here's what we can help you with, and here's what we're doing to signal where you're going. It's like the Joint Commission signals, here's where we're going. It makes such a difference. The Hospital Association, the Medical Consortium, they're saying, here's where we're going. Those people that are dragging or in the broad middle that are not really engaged, it'll move them on to action. It gives them a pathway. I think it's very important.
Thank you so much. It's really such an honor to be here. I feel like I'm here to drink from the well. There's just so much inspiration. It's so great to see old friends and new friends, and just really delighted. Thank you to NAM for making this event possible. Really wonderful. I'm here to speak on behalf of the Global Consortium on Climate and Health Education. And our mission is to ensure that all health professionals throughout the world have the knowledge and skills to identify, prevent, reduce, and respond to the health impacts of climate change, thereby reducing health disparities and improving quality and health and well-being. So the last time I looked, I actually Googled it right before we came up here, there are 65 million nurses, doctors, pharmacists, and midwives, as well as allied health professionals. And that's not even accounting for public health professionals, hospital administration. I mean, maybe 100 million people who really have their professional focus globally. That's incredible. And they are in every single community. At the end of every dirt road, there is a health professional. And so our mission is to reach every single one of them. And that is the work I'm going to tell you about next. So this slide is courtesy of Dr. Howie Frumkin, and he is describing the many roles of the health professional, right? We know that nurses are the #1 trusted professional in our country, followed by doctors and pharmacists. But we work in so many different ways, clinically, as researchers, as institutional leaders, as private citizens, and as trusted community voices. And so there's been increasing calls that we need to leverage our health professionals, right? The problem is most of these health professionals don't know what we want them to do, nor do they really have the time to deeply understand that. And so how can we bring the ways that climate change is impacting the health of their patients and what they can do about it to their hands? And that's what we're trying to work on. So the Global Consortium started out as an organization to build a coalition of the willing back in 2017. There was 60 schools which got together and said, we are going to pledge to train our students in climate and health. Since 2017, we've grown to now be over 370 institutions in 80 different countries. We're reaching approximately 250,000 students every year, which is incredibly exciting. Now, that means we have leadership bought in. Somebody at the dean or head of school had to pledge. Generally because there's a pack of slightly angry Gen Zers who are telling them they need to do this. Now the problem is, who is going to teach this? And you have this cohort of mid-career professionals who never had this in their training. And I learned this very early on in coming to the consortium. So we started setting up courses. We said, well, we have to train people. So we've taken a regional approach, and we're covering the globe. And what we do in each region is we pull together leading health, leading academic, leading NGO organizations to get together. So right now we're running our Africa Climate and Health Responder course. We have the Association of Schools and Programs of Public Health in Africa, together with Africa CDC, WHO Afro, and several other research and medically oriented organizations in Africa. Now, what's so interesting is when we first started running these programs, we created this curriculum based off our core competencies for health professionals. We hired an incredible faculty from the region to teach this course, and we opened up registration for free, and we said, we'll give you a certificate if you attend 70% of the courses. And I sat back and I said, I really hope we get like 50 people here, because this is a lot of work. And the first course we opened in Latin America, we had over 5,000 health professionals register. And I was blown away. Like, we crashed our Zoom platform. Like, I had to call IT and be like, we need a bigger platform. How do you get one? And what was fascinating is I was able to sort of look at the demographics. And we were seeing 30% of our registrants were coming from .gov email addresses. We're coming from the private sector. We're coming from NGOs, from food banks, from women's shelters. I mean, we were trying to run an academic program for faculty, right? But we made it free, and we told everybody about it. And suddenly, we had the entire Ministry of Health of Uruguay show up to our course. I mean, our reach was suddenly incredible. And this was because we brought together partners. We brought together friends, and many of you are in this room, and you know that you've worked with us, and that's because we've worked together to make this happen. So over the past 18 months, we've trained over 35,000 health professionals. We provide free courses. We give certificates. These are evidence-based, and these are based on competencies. We also provide smaller trainings and technical workshops. 35,000 sounds like a lot, but when there's something like 100 million out there, we have a long way to go. But we're excited by this early success. I've heard some really funny anecdotes. We take attendance at our courses, and people are like missing work meetings to come to the course, which we don't write sick notes, but it's exciting. People are really prioritizing this, and this is a growing movement. We've also been thinking a lot about community, right? And as I said, there's a health professional at the end of every road in every community, and how do we work with communities around this? So over the past year, we have 2 initiatives right now, one going on in the Dominican Republic to work with impacted communities, and one working with frontline community health workers in India. And what's so amazing to me is when we're in these rooms with communities and we're talking about climate impacts, they're all shaking their heads and they're saying, oh, we know. This is happening every day, and they're standing up and they're telling us stories. They're actually teaching us what is going on in their communities. And the feeling in the room is, and what I've heard is that they're just so happy that someone is finally talking about this, because they've been living this for years and years. And so our work is continuing to sort of expand in a really innovative way to say, how can we reach people where it's going to make a difference? And how can we equip health professionals and communities with the skills that they really need and the knowledge that some of them already have, but some of them need reinforcement on to be able to adapt to these new impacts that are being seen. We need to monitor our impacts. We need to monitor our progress. And so we're so delighted to have partnered with the Lancet Countdown on Climate Change and Health for a global survey, which we send out every year. It's actually open right now, surveying schools and institutions which train public health professionals, and soon we'll be expanding to medicine and nursing. We need to understand what's happening in our schools. What are health professionals being taught? Not as a way to be, punitive about it, but a way to sort of say, where can we improve and where do we need more training? Where can we put more courses? Where can we dedicate our resources to reach the regions that don't have a lot of uptake? And I'll give you a hint. These are happening in areas, they're some of the most climate impacted, and that's where we're really focusing a lot of our efforts. And so that's it. I'm going to wrap up there and just say, we're so happy to be here and always open to partnerships. My experience is that partnerships are the only way we're going to do this. And I think we all here have incredible organizations to bring to the forefront, and I look forward to working with everybody. Thank you.
Okay, for those in the room who are going to work with Cecilia, raise your hand. Okay, everybody wants to do that. Fantastic. Thank you very much. I hope this shows for the people online, the people in the room, there is a lot going on. It's an enormous problem. No one of us can do it on our own. Dr. Zhao pointed out we need a very big tent to attack this very big problem. And Dr. Frist said he has people pushing back all the time, not knowing what can be done. Well, there's a lot that can be done. There's research, if you're a researcher, there's community engagement, there's health equity issues that need to be addressed, there's financial gains to be made, there's staffing inspirations that can be done, there's food. If the children don't inspire you, you're probably not going to get inspired. I think the opportunity is enormous. And the key to this meeting, both online and in person, is that no one's in it by themselves or have to do it all by themselves. This is a great convening of people from many backgrounds who are leaning in on this work. So you can find a partner regardless of your interest. The one request is to not stay on the sidelines, but engage, because we have to not just chat, we have to really get things done. Thank you very much for your attention. Thank you to the National Academy for putting this on. Thank you, Victor.